Hi, my name is Jada Barrow, and the topic that I chose today is first aid survival skills everyone should know. Imagine someone collapses near you. Would you instantly know what to do? Emergencies can happen anywhere at any time. Everyone should know basic first aid to help you respond quickly and potentially save a life. There are 3 essential first aid skills that everyone should know, such as responding to an emergency, treating common injuries, and life-saving techniques. The first step everyone must know is how to respond to an emergency. It is so important to stay calm and assess the situation. Ask yourself, is there danger around? Is the area safe? Is the individual unconscious? Is the individual responsive? All of these are questions that need to be answered before proceeding to the next step. The next step is to call 911. Always call 911 even if you aren't 100% sure if the person is okay. It is better to be safe than sorry. It is also a good idea to additionally call an adult or another authority figure. Give clear information to 911. They will need the location and details on what has happened. While you wait for medical personnel to arrive, you may begin assisting the victim if needed. Some injuries may be out of your expertise, but following the basics are always helpful. It is important to have knowledge in treating common injuries. If someone is bleeding, it is important to apply pressure and always keep the wound elevated. Some bleeding may require slight pressure, and some may require serious pressure. Arteries are an example of this. According to verywellhealth.com, arteries are the largest blood vessel and carry a lot of oxygen. If they are injured, bright red blood will splurt out. Blood can be lost very fast with this kind of bleeding. For burns, use cool water instead of ice-cold water. It is a common misconception to use ice-cold water to soothe a burn. According to Cleveland Clinic, using ice on a burn can lead to permanent blood flow problems, increasing your risk of infection and reversing the healing process. Dr. Kappen. After cooling down the burn, cover lightly with a bandage. When the blister forms over the burn, do not pop it. Let the blister go down on its own. It has healing properties. Now, sprains and broken bones are a little more severe in most cases. If you sprain or break a bone, the first thing to do is to stop moving. Keep the injured area as still as possible to prevent the bone from moving. Use ice and supports like wraps or splints to compress everything together and prevent anything from moving. All of these are fixable and not always life-threatening, but in some cases you may be met with a life-threatening situation. There are many serious life-saving techniques. According to verywellhealth.com, cardiopulmonary resuscitation, or CPR, is the most important medical procedure that a person can know. CPR is not performed like it's shown in the movies. CPR stands for cardiopulmonary resuscitation. Cardio means heart. You give CPR to someone whose heart has stopped beating or someone who has stopped breathing. The American Red Cross states that the first step of giving CPR is to lay the individual on a solid flat surface. Step 2, position the 2 hands centered on their chest. Step 3, make sure shoulders are directly over hands and their elbows are locked out. Note that compressions need to be 2 inches in depth at least. Step 4, start compressions. You should be doing 100 to 120 compressions per minute. Step 5, tilt the head to a past neutral position, open the airway. Next, pinch the nose shut and give the individual 2 breaths. The chest should be filling up with air each time. Allow the chest to return back to normal position after each compression. Continue to give sets of 30 chest compressions and 2 breaths until emergency medical personnel arrive on scene. Another life-threatening situation is when someone is choking. It is important to recognize the signs of choking. The most common signs are gagging, gasping, wheezing, inability to talk or make noise, turning blue in the face, grabbing at the throat, waving arms, and looking panicked. According to verywellhealth.com, choking happens when a person's airways become blocked by food or an object. It is a serious event that can lead to unconsciousness or even death. To help dislodge the object from someone's airway, you must do the Heimlich maneuver. verywellhealth.com also states that step 1 of the Heimlich maneuver is to stand behind the person and lean them slightly forward. Step 2, put your arms around their waist. Step 3, Clench your fist in place between their belly button and rib cage. Step forward, grab your fist with the other hand, and pull the clenched fist sharply backward and upward under the person's rib cage in 5 quick thrusts. Lastly, step 5. Repeat until object is coughed up. It doesn't hurt to take classes on CPR and the Heimlich maneuver. Knowing the basic first aid can help you respond quickly and potentially to save someone's life. I have covered the 3 most common tips: responding to an emergency, treating injuries, and performing life-saving techniques. You don't have to be a doctor to save someone's life. Just knowing basic first aid can mean everything.